Hello, thank you for joining us. I'm Arlene Borenstein. Today, we're going to share with you what you need to know about heart health with the help of our family medicine specialist, Dr. Richmond Ramirez. If this video is helpful to you, please hit the share button to share with a loved one. You'll also find an interactive menu to type in a question during the webinar that will be answered at some point following the presentation. If at any point in time your screen stops, delays, or shows a blank screen, try refreshing your browser to get the experience up and running again. Also, we would love if you could follow us on Facebook by searching CenterWell Senior Primary Care. You can even help us pick our next webinar topic by taking the exit survey and polls following the webinar. And without further delay, let's learn about heart health with today's speaker, Dr. Ramirez.
Welcome to this talk all about heart health. Things to remember, and before we get started, let's go over a few reminders. The things we talk about today don't replace professional healthcare. For medical guidance, talk to your doctor. Consult your doctor before beginning any new exercise or dietary regimen. This class is a safe zone, and this presentation was developed by CenterWell in consultation with clinical staff. During today's class, you'll learn why is heart health important, all about high blood pressure, high cholesterol, and diabetes, risk factors for heart disease, and tips to keep your heart healthy. By now, most of us have heard that eating a lot of cholesterol and saturated fat isn't good for our hearts. Maybe some of you have made changes based on that advice, like cutting back on eggs and bacon at breakfast time. Maybe you'd like to make a change, but you aren't really sure where to start. That's what we'll be talking about today. During today's class, we learn about the basics of heart health, high blood pressure, and high cholesterol. We're also going to talk all about a heart healthy diet. There are lots of foods you may want to stay away from, but we're not just going to talk about what we can't eat. The answer isn't to focus on what we have to give up, but what we can add to our diets. There are plenty of heart healthy foods out there, and you'll learn that it's very easy to work them into your everyday diets. So without further ado, let's begin. According to the National Institute of Aging page, Heart Health, your heart is a muscle about the size of the palm of your hand. It acts kind of like an engine. Its job is to keep your body running, just like an engine keeps a car running. It's capable of sending a drop of blood from your head all the way down to your toes and back up again in just 1 minute. Your heart has two pumps. One pump sends oxygenated blood away from the heart to the organs of the body using blood vessels called arteries, and the other pump brings the oxygenated blood back to the heart and then to the lungs to get re-oxygenated. Your heart and blood vessels make up your circulatory system, which supplies oxygen and nutrients to your body. If the heart isn't working like it's supposed to, your body's important organs won't be able to get the oxygen and nutrients that they need to survive. This can lead to many life-threatening problems. In fact, heart disease, which is an umbrella term for many different problems that can occur within the circulatory system, is the leading cause of death in the United States, according to the NIA. The National Institute of Aging says that most heart pumping problems are the result of heart disease, not getting older. An older heart can usually pump blood as well as a younger heart, but the diseased heart and blood vessels will have problems pumping effectively. The most important type of heart disease is called atherosclerosis, which is a buildup of plaque and fatty substances in the walls of the arteries. It's sometimes referred to as hardening of the arteries. This buildup clogs the arteries and prevents blood from being able to flow through smoothly. Atherosclerosis causes CAD, or coronary artery disease. It can lead to narrowing of the arteries and blood clots that can result in a stroke or heart attack. A heart attack happens when a section of the heart dies or gets damaged because it's not getting enough blood. Signs of a heart attack include crushing chest pain, discomfort or pain elsewhere in the upper body, neck, or arms, nausea, a cold sweat, faintness or lightheadedness, shortness of breath. If you think or someone you love is having a heart attack, it is important to call 911 as soon as possible to get care quickly. The more time that passes without treatment, the more damage is done to the heart. A stroke occurs when something, like a blood clot, for example, blocks the blood flow to the brain. Brain cells begin to die in a matter of minutes without oxygen. The National Institute on Aging page entitled Stroke says that the signs of a stroke include sudden numbness or weakness in the face, arm, or leg, sudden confusion, trouble speaking, or difficulty understanding speech, sudden trouble seeing in one or both eyes, sudden trouble walking, severe headaches of no known cause, loss of balance, or lack of coordination. Just like a heart attack, it's very important to get care quickly. The longer you get to care, the more brain cells will die. Let's begin today's class by discussing what you should know about heart troubles. This will help you understand why making heart healthy choices is important. So, what is heart disease? According to the National Heart, Lung, and Blood Institute, heart disease occurs when the arteries become hardened or narrowed due to plaque buildup. Risk factors for heart disease include high blood pressure and high cholesterol. What is high blood pressure? Blood pressure is the force of blood pushing against the walls of the arteries. If this force is too high or too long, it can damage the heart and blood vessels, leading to heart disease. What is high cholesterol? Cholesterol is a waxy, fat-like substance found in the body. If too much builds up inside the arteries, it makes it hard for blood to flow through them. Over time, the blood vessels can become too narrowed for blood to flow through, leading to heart disease. Many of the nutrition concepts we'll be talking about today may help prevent these conditions. The National Heart, Lung, and Blood Institute's page, Coronary Heart Disease Risk Factors, describes high blood pressure as blood flowing through the vessels at a higher than normal pressure. Over time, high blood pressure can damage the heart and blood vessels. It is important to know the different blood pressure ranges so that you can understand where you fit in. In 2017, new guidelines from the American Heart Association and the American College of Cardiology lowered the definition of high blood pressure. This means more people will have the condition. The new guidelines state that the normal blood pressure is less than 120 over 80. Elevated blood pressure is systolic between 120 to 129 and a diastolic between 80 to 90. Stage 1 hypertension is systolic between 130 to 139 or a diastolic pressure between 80 to 89 millimeters mercury. Stage 2 hypertension is systolic at least 140 or a diastolic pressure of at least 90 millimeters mercury. Keep in mind that it's important to talk to your healthcare provider to find out exactly what he or she thinks your blood pressure should be. High blood pressure often has no signs or symptoms, so it's important to get it checked at least once per year, or more often if you have a history of high readings. Cholesterol is a soft, waxy, fat-like substance that's found in your body's bloodstream and cells. Cholesterol is important because your body actually needs some cholesterol to function well. So it's not always a bad thing. It is made by the body, usually in the liver and other cells, and it's found in some of the food people eat, mostly animal products. Too much cholesterol can build up inside the arteries, making it hard for blood to flow through them. When this happens, it's called atherosclerosis, or narrowing of arteries due to plaque. It's dangerous because it can cause your heart to get enough oxygen-rich blood. It's dangerous because it can cause your heart to not get enough oxygen-rich blood. According to the National Heart, Lung, and Blood Institute page, high cholesterol is a major risk factor for heart disease. The higher your blood cholesterol level, the greater your risk of developing heart disease. Luckily, there are many different things you can do and choices you can make to help keep your heart healthy. For the remainder of today's class, we'll talk about these things: managing your heart conditions, maintaining a healthy body weight, staying active, eating a heart-healthy diet, and avoiding smoking. The first step in working toward keeping your heart healthy is preventing or managing health conditions. We've talked about high blood pressure, high cholesterol, and diabetes. Each of these conditions can have a negative impact on your health and blood vessels. Make sure you talk to your doctor about screenings for this condition Talk to your healthcare provider how often you should have each screening. If you have a heart condition and have been prescribed a medication or other treatment program, be sure to adhere to your healthcare provider's orders. The tips that we'll be making about today, like maintaining a healthy body weight, staying active, and eating a heart healthy diet, this may help you manage these health conditions better too. According to the National Heart, Lung, and Blood Institute, diabetes is a condition that develops when the levels of sugar in your blood gets too high. This happens because either your body does not make enough insulin or the body isn't using insulin properly. We all know that insulin is a hormone that helps blood sugar get into the cells so that it can be used as energy. Prediabetes refers to blood sugar levels that are high, but not high enough to be diagnosed with diabetes. It also means that if you don't make changes, your risk of developing diabetes in the next 10 years is high. According to the National Heart, Lung, Blood Institute, over time, diabetes can cause atherosclerosis. Being overweight increases your risk of heart disease. But the good news is that you can experience big health benefits by losing a small amount of weight. The National Heart, Lung, Blood Institute says that a loss of just 3 to 5% of your current weight can help you improve many of your heart health numbers, including blood glucose, blood pressure, and cholesterol levels. To find out if you need to lose weight, you can start by learning your BMI, or body mass index, or measuring your waist. Your BMI is determined using your height and your weight, and a BMI of 18.5 to 24.9 is considered normal. A BMI of 25 to 29.9 is considered overweight, and a BMI of 30 or more is considered obese. Extra weight in the stomach area can also increase your heart disease risk, so it helps to know your waist measurement. For men, a waist measurement greater than or equal to 40 inches will put you at an increased risk for heart disease. For women, a waist measurement greater than or equal to 35 inches will put you at a greater risk as well. To keep your weight healthy, ask your doctor how many calories you should consume each day, and do your best to stay within those limits. Eating well and being active can also help. So we'll talk about those things next. Being active has a lot of benefits. Not only does it keep your heart healthy, but also it can control your blood pressure and cholesterol. It can help you manage stress, boost your mood, and maintain a healthy weight and keep you strong and independent. So the National Institute of Aging recommends that healthy older adults get 30 minutes of moderate intensity activity on all or most days of the week. It doesn't have to be done all at one time. You can break it up into 3 10-minute segments if you'd like, and it still get the same benefits for your heart. What are the good examples of exercises that may be good for your heart? All exercise is good, but cardiovascular exercise or aerobic exercise is particularly beneficial. This includes activities like brisk walking, hiking, jogging, swimming, dancing, or cycling. Before you begin a new exercise program, make sure you talk to your doctor to find exactly what's right for you. He or she might have specific recommendations as well as guidelines for you to follow. Quitting smoking reduces your risk of heart disease and other heart conditions right away, and the benefits gets better as time goes on. While quitting isn't easy, here are some things that can help. First, you can find your motivation. Think about all the things that you'll gain from quitting: a longer life, more time to spend with your family, money saved. Write them down and keep them in some place important so you can look at them when things get tough. Second, get a support system. It will help to have someone, like a friend or family member, to be there to help you. You can share your progress and get encouragement from them when you need it. Third, find a replacement habit. You might want to find a new activity like exercise or meditation to replace smoking with. That way, each time you want to smoke, you can engage in a healthy behavior instead. And finally, keep yourself busy. Find things to keep your hands and mind occupied. Eating a healthy diet is also important for keeping your heart in tip-top shape. In their booklet, Your Guide to a Healthy Heart, The National Heart, Lung, and Blood Institute says that the heart healthy diet emphasizes these foods: fruits and veggies. Look for brightly colored fruits and vegetables and try to incorporate both in every meal. Whole grains. Whole grains are high in fiber, which is good for heart health and digestion. Choose whole wheat or whole grain bread, pasta, and rice. Fat-free or low-fat dairy is the third one. Dairy products offer nutrients that are good for you, but they can be high in fat and calories. Choose fat-free or low-fat versions of things like milk, cheese, and yogurt. Choose the fat-free or low-fat versions of things like milk, cheese, and yogurt. Fourth is lean protein. Skinless poultry, lean meats, fish and beans are all great protein options. Fatty fish like tuna, salmon, and trout have heart-healthy omega-3 fatty acids. And the last thing to do is to watch portion sizes. A heart-healthy diet limits the following: trans and saturated fats. Trans fats are commonly listed ingredients like hydrogenated or partially hydrogenated oils. Saturated fats are commonly found in fatty cuts of meat. Second, avoid sodium. A diet high in sodium is heavily linked to high blood pressure. And third, added sugars. Foods that have high sugars added to them during preparation or processing add excess calories. For the remainder of today's class, we'll be talking about each of these things, starting with choosing the right types of fats. In addition to the things we've discussed, it's important to practice portion control. According to the Mayo Clinic, how much you eat may be just as important as what you eat. But how can you keep portions small in a world where they seem to keep getting bigger and bigger? To help keep your portions a healthy size, these are a few things you can do. Number one, measure your food. Use measuring cups, spoons, and scales. Number two, use your hand as a guide. Your palm is about the size of 3 ounces of meat or fish. The tip of your thumb is a teaspoon. Your thumb is an ounce of food like cheese, and your fist is about 1 cup. Third, you can use a small bowl or plate. Use a salad plate instead of a dinner plate. This helps you see that your plate is full and can help in preventing overeating. Next, you can make your own single serving packs. Reportion food that came from large servings like nuts, chips, and cereal into individual portions in bags or small storage containers. Not only can this save you some calories, but it can also save you money. So do your best to never eat straight from the package. Lastly, listen to your hunger cues. Do your best to stop eating when you feel satisfied, not stuffed. Okay, first up is fats. There are 3 types of fats: unsaturated fats, saturated fats, and trans fats. According to the American Heart Association, fats have a lot of important functions in the human body. So you do need some in your diet, but not all fats are created equally. Some types of fat can have negative effect on your health, while others may have benefits. Unsaturated fats, which include monounsaturated fat and polyunsaturated fats, may have heart healthy benefits. The AHA, or the American Heart Association, says that when eaten in moderation and consumed in place of unhealthy fats, unsaturated fats may keep your heart healthy by lowering bad cholesterol levels. These types of fat are found in foods like canola and olive oil, avocados, natural peanut butter, nuts and seeds, and fatty fish. Saturated and trans fats, on the other hand, may increase your risk of certain conditions. According to the American Heart Association, they may raise the levels of bad cholesterol in the blood. For this reason, they are not recommended as part of a heart-healthy eating plan. Saturated fats are found in red meat and full-fat dairy products. Trans fats are found in fast foods and foods with partially hydrogenated oils. How can you get more good fats in your diet? Let's look at a few different things you can do, according to the Mayo Clinic. Replace bad fats with good fats. Some simple swaps you can make include: use olive oil instead of butter or margarine. Put avocado in your sandwich instead of mayonnaise, and trade potato chips for nuts, olives, or veggies with hummus. Instead of eating red meat, try to incorporate more fish in your diet. Remember, fatty cold weather fish are rich in omega-3 fatty acids. You can also look for lean cuts of beef and pork and remove the skin from your poultry. According to the American Heart Association, 9 out of 10 Americans consume too much sodium and the heart health is often affected. According to the Harvard School of Public Health, your heart health is part of your body most affected by consuming too much sodium. In short, consuming too much sodium makes your heart work harder and it increases the risk of hypertension, heart attack, and stroke. Reducing sodium isn't always easy, but it can be done. Let's look at some tips from the National Heart, Lung, and Blood Institute. First, avoid processed and restaurant foods. The Centers of Disease Control and Prevention says that the majority of sodium in the American diet comes from these two sources. You can also look for low sodium versions of the foods you eat. Choose foods packed in water instead of broth and salt, as well as buying foods labeled as low sodium, sodium free, or no salt added. Speaking at looking at labels, you can learn about the amount of sodium in packaged foods by looking at the nutrition facts label, as well as the ingredients list. Sodium is always listed in the label. You may also want to add herbs and other seasonings to your food instead of salt. This can help add flavor to your food without the unwanted sodium. And lastly, be patient. Give your taste buds time to adjust. If you tend to be heavy-handed with the salt shaker, bring it down or just a sprinkle. Eventually, you may find that you don't need to add salt to your food at all. Now, let's look at the added sugars. Added sugars provide no essential nutrients. This means they're just extra calories. Limiting added sugars can help you focus on nutrient-rich foods and stay within your calorie limits to avoid unnecessary weight gain. According to the Harvard School of Public Health, American adults consume, on average, 22 teaspoons of added sugar each day. That's equivalent to 35 calories, all of which provide zero nutritional value. The American Heart Association recommends limiting the amount of added sugars you consume per day to no more than 100 calories or about 6 teaspoons for women, and no more than 150 calories or about 9 teaspoons for men. 1 teaspoon of sugar is equal to about 4 grams of sugar. So 6 teaspoons of sugar is about 24 grams, and 9 teaspoons is about 36 grams. To reduce the amount of added sugars in your diet, the National Heart, Lung, and Blood Institute recommends avoiding some of the main sources: sweetened drinks like soda, fruit juices, coffee, and tea, and sugary snacks and sweets like cakes, pies, cookies, ice cream, or donuts. The National Heart, Lung, and Blood Institute recommends getting at least 5 to 10 grams of soluble fiber per day, with 10 to 25 grams per day being even better. There are 2 types of fiber: soluble and insoluble fiber. Insoluble fiber helps keep your digestive system moving, but soluble fiber can help lower your LDL cholesterol, according to the National Heart, Lung, and Blood Institute. During digestion, it dissolves into a gel-like substance that helps block cholesterol and fats from being absorbed. In fact, the National Heart, Lung, and Blood Institute says that increasing soluble fiber intake by 5 to 10 grams per day may result in a 5% drop in cholesterol levels. Examples of soluble fiber include oat bran and oatmeal, nuts, seeds, beans, lentils, peas, and some fruit and veggies. You're probably not surprised by this, but fruits and vegetables can have tremendous health benefits. According to the Harvard School of Public Health, a diet rich in fruits and vegetables can lower your blood pressure, reduce the risk of heart disease and stroke, and prevent some types of cancer. To try to get more fruits and vegetables, keep them out where you can see them. That way, when you're looking for a snack, they're in eyesight and readily available. Try to buy fresh whenever possible. This will ensure that you're avoiding unnecessary sodium. If you do need to buy canned or frozen, check the nutrition label and choose the version with the least sodium and no added sugars. You can also add vegetable to your favorite meals. Salad and stir fries can help you get more veggies in your plate, but you can add them to pizzas, pasta dishes, casseroles, soups, and omelets, or toss some fresh berries on top of your oatmeal, cereal, or fruit. You can also try new varieties. Now, I'd like you to take some time to think about the things we talked about today and choose something that you'd like to work on to make your heart healthier. Your heart might be small, but it has a big job. It pumps blood all over your body and delivers oxygen and nutrients to all of your organs. That's why it's important that we take care of it well. Problems like atherosclerosis, high blood pressure, high cholesterol, and diabetes can increase your risk of heart disease. Heart disease is a major health concern in the United States, and the food you put in your body play a big part in your risk of developing it. To keep your heart healthy, make sure you follow the tips we talk about in today's class. 1. Manage your heart conditions by following your doctor's orders. 2. Maintain a healthy body weight. 3. Stay active by trying to get 30 minutes of exercise every day. Eat a heart healthy diet full of fresh fruits and vegetables, whole grains, low fat dairy, and lean protein. And quit smoking if you need to.
Thank you to Dr. Ramirez for sharing more on heart health today. We also really appreciate our audience for spending a little bit of time with us. So thank you. There are some resources here on the website you can reference. If you have any questions about becoming a patient, please don't hesitate to contact us. And you can always find us on Facebook by searching CenterWell Senior Primary Care. Wishing you great health. I'm Arlene Bornstein.